A very good evening to Emma Kasimende Ethu, Aga United Holdings. It's been a minute, but it's been a minute. Sethembe ukuthi emalangeni aphilile, sethembe ukuthi amaswahili amahle aphilile. Kulelanga lanamuhla sibonge ukuthi nisijoyine futhi nihlangane kanye nathi. Sizama ukuniphatha indzaba demshwalensi lo ehlukahlukene lo provider United Holdings. United Holdings nanyalo solo sisasho ukuthi sinani indlela yonke amaswati amahle uko konke siyazama ukuthi siwasupport amaswati ngendlela lesi khona ukusupporta ngayo United Holdings. Sinemishwalensi ehlukahlukene percentage kafanele sinato letine ngaphasi kwa United Holdings. Namuhla ke sidabe sina United Health Insurance lo taba sichazisela kabanti ngemshwalense wetempilo laba provider ko ukuthi nje ngingisimpiwe ngisekhaya noma ngilikhasmende ngisekhaya ngingakhona kanjani ukuthola kusitakala lokungiko mhlambe kusitakala lokutangenetisa nami kungakhali lo munye uke wakhuluma nje emakhasmendeni ethu asiyathi ngike ngaphafagula ngisengajoyini nangiphethe ngilokugula nangesibhedlela ngathi khanza ngihlala isikhathi leside solo ngasitakali ukuthi nje bengidi medical aid ngase nangifika la United Health Insurance impilo nje yasishintsha nje bamnanzi nganiphokwetile washo ukuthi uthokete kakhulu impela nanathi ngiloko lesikufunako United Health Insurance kusema emaswati lamahle nathi nje usito betempilo avile nje aqhuze emtholampilo athola kusitakala masinyane anginganzi kakhulu balalele emakhaya namhla nginikede babe ubabe ngepha Nkosi yami but ke asenhloniphe nje namuhla nje ngihloniphe ngoba ngimcelile kusangiphe isikhathi sakhe ngina Mr Mathebula lo sijoinile long operations manager wa United Health Insurance lo tabile stabe sicocisana naye namuhla babe Mathebula sawubona
sivusele nabo obukeli welihlelo lwakho nekusho ukuthi siyajabula kuphinza namhla sebephinza sibajoyine sebenalo la ehlelweni labo labathanza kakhulu lwa United Holdings lapho khona sibathulela khona tindzaba letimnanzi labafuna abatati mayelana nemshwalense wabo wa United Holdings kuto tonke tinkampani letotine lesinato la ka United Holdings.
Sibonge kakhulu Mr Mathebula. Ngubita kahle lokuthi ngibabe Mathebula noma nje sengiyagugisa.
Baye bathi Nkosi but WhatsApp khulelwa so kusho ukuthi ngiyabona nami ukuthi cha sengifikile esigaba sekuba ngibabe so kudinginga Nkosi.
Asensembe ke babe Mathebula ukuthi cha utalibatha mbamba lejazi lababe awuthi nje sisekhalweni sibone sekuthiwa namusiboni ubona ukuthi kukhula vele nawo kusekusemnyango Mr Mathebula singene enzabeni yethu nala yanamuhla ngicela sina singaqala nje usithi nje kancane ukuthi ufika kanjani United Health Insurance yini lama products awa provider.
Yes, sibonga Nkosi. United Health Insurance inkampani letholakala khona la ngaphansi kwa United Holdings lapho khona sineti inkampani letine ngicabanga ukuthi balaleli babukeli bayadati ngoba ngicabanga ukuthi njalo ngeliviki uyabathula dona. United Health Insurance ke ngilenye letinkampani letine letholakala la United Holdings letisebenza ngemshwalense. United Health ke usebenza umshwalensi lo sita emakhasmende kakhulu kati lapho kuthi ngakhona ukuthi baye emitholampilo. Siyathi ke Nkosi ukuthi imitholampilo seyadula ikakhulu kati ngoba nekugula kwabantu nabo kuya ngekudula so kuyenda lokuthi ukhanze ukuthi kuyadula ikakhulu kati na utawufuna uthola lusito mhlawumbe etinkampanini letholakala ukuthi noma kude ufuna lithola sito kuleto dibhedlela khanza ukuthi lusito lwakhona liyashesha luphindze futhi uthole ukuthi lusito lwakhona wasezingeni la khona ugculiseka khona umuntu ukhanza ukuthi na uphuma khona ukhanza ukuthi bakakujova nekukujova kepha nje utivele ukuthi hayi sengiphilile noma bangangijova so ke United Health Insurance ke usita ukuthi sikhone kuya kuleto dibhedlela leto la ukhanza ukuthi khona siyakhona ukuthola lokunakekeleka ngalendlela lesingafisa ngayo uma sigula ngoba na ugula awutsanza kuya noma nguphi lapho khona ungeke unakekeleke kahle khona so ke siyinkampani ke sabuka ukuthi kunemaswati lamaningi lokhanza ukuthi akakhona ukufinyelela kahle kuleti nsita tasemtholampilo noma ke kulabo medical aid because medical aid has been expensive for the ordinary Swazi. So sabese ke sibuka ukuthi they just try to bridge the gap emkhathini walabo lokhanza ukuthi abakhona ukuyithatha le medical insurance because income yabo labayithola njalo ngenyanga ukhanza ukuthi incane ngeke bakhona kubhadala imali letifika ku 2000 emalangeni a month for medical insurance alone. So we then decided to come up with covers that awukhona ukuthi afithe likhikhi labo bonke abantu lesinabo eSwatini kuze ukuthi bakhone kuba nayo le medical insurance. So ema products ethu ke sinawo ama plans lahlukahlukene lapho khona ama client ingakhona ukuthi iyithathe leyo plan le ikhanza ukuthi itamlungela kepha ke ngosi noma ukhanza ukuthi le plan mhlawumbe ayisiyo ledulile kepha ke siphinze sithi iclient ayingajake kubuka lokushipha kepha ibukele ukuthi ingilephile kanganani because you may take a cover because it's cheap but you find that kuloko kuphila kwakho noma kuledzingo takho mayelana nempilo yakho khanza ukuthi ayisayisave le purpose that you're taking the cover for. So we then encourage ukuthi people must ensure that they take the right cover for themselves le tawulingana mhlawumbe nedzingo dabo lapho ukhanza ukuthi sebathenga khona ke emtholampilo. Ama-plans ethu ke yaqala ku 311 emalangeni ngenyanga aye ngekhula ke depending on the need of the individual and also their affordability. But lokho kahle ke ngosi ukuthi the structure of our plans from layer 311 emalangeni going up to layer 2375 emalangeni onke lama plans lesinawo ngosi le structure sawo sinye lokusho ukuthi onke sawenda ngendlela yokuthi uyakhona ukuthi ikulalise esibhedlela uma ngabe dokotela afuna ukulasa esibhedlela iphinza futhi uyakhona ukuthi uye emtholampilo ubone dokotela uphinze ubuyele ekhaya if you need if kungabe ukuthi ngeke ukuthi ubone dokotela phinze ubuyele ekhaya and other benefits including kuyothola tibuko kulabo lokhanza ukuthi sebanenkinga yemehlo ukhona ukubona abo dentist uma ngabe umuntu osadzinga ke ubona dentist ukhona nekwenda medical checkups leswa encourage ukuthi uyende njalo ngeminyaka and also ukhanza ukuthi nawo ke nabo OTC ukhona ukuthola umuthi epharmacy uyakhona futhi nekuyo kunakekela bo chronic conditions esinawo afake ikhazi boshukela bo BP phinza futhi ke ngosi I think we might be the only provider in the country lesinika access to even herbal medication lokhona ukuthi uyeke uyithola laphana eDuxebal. So ama clients ethu ke anale lithuba lelo lokuthi mangabe nje sengeka siyathi singemaswati siya esibhedlela lesifika nebelungu kepha ke siphinza futhi netimbita zethi-70s. So ke uma ngabe ngiloyo muntu okhanza ukuthi imbita ayisebenzisa ngiyacabanga nje live lonke kulamalanga belifutha ngalesikhathi se-COVID sikhombile ukuthi kufuna siyofutha bese ithola i-eucalyptus oil laphana eDuxebal sihambe siyofutha sizame ukugwema ukuthola i-COVID. So naletinye timbita lokhanza ukuthi lapha faka ekhazi timbita tema-ulcers timbita tema-piles tinto leti kanjalo imbita elihlanga bakhona ukuthi bakunikede ulapheke ubuye uphile because lesimcabanga ngawo kakhulu as as a company is to ensure ukuthi emaswati ayakhona ukuthi aphile regardless of the means that they need to take. It could be medication yesilungu, it could be herbal medication njengoba ngishilo. So we give you that opportunity to use leyo medication that you believe itakhona ukuthi iku-assist ubuyele ube ngilophilile ngozi.
Yabona ngilandzele eucalyptus oil nemakhathakhatha Mr. Mathebula. Iyangifokotisa impela. Ingifokotisa impela ngoba uyukhanze ukuthi lamanye nje makhasimende ayaye esibhedlela yolufuna usizo but angalifoni. Sibonga nje United Health Insurance unayo le understanding ukuthi nangaba ukhona unconcotha ngalana ungalitholi usizo na opportunity ukuthi unconcothe ngalaceleni uthole usizo malangeni lamahle United Health Insurance no ungakhona nje ukuthola emakhathakhatha lapha edictable nge-medical aid yakho nge-health insurance card yakho nje uthole usizo abobheka mina ngedwa ngiyabathola yini Mr. Mathebula ngoba phela nawo somakhathakhatha.
Yeah, ibese hlupha lapho kwenkosi lenzaba ukuthi bese sesifuna ukuthola bobheka mina ngedwa nabo losilina kanti phela bona akusiko abelaphi unfortunately bona bekusita nje ukuthi sibe netinhlanhla ngoba ukhanza ukuthi labanye so ukhanza ukuthi usude tinhlanhla. So will not give you le benefit yokuthenga tiwasha letinhlanhla nabo bheka mina ngedwa
asikukhuthathe ngalokulapha nini
asikukhuthathe empeleni lokuthi bese ufuna ukubheka mina ngedwa ngoba kusho ukuthi so interference ne nature which is not a good thing to do.
Asikhuluma ngephandle le yabheka mina ngedwa mphathi ngoba ngathi mina lobheka mina ngedwa ngicoko ngaye hayi bese ladzabukile manje sikhubeke mphasi-ke sengayicedile ndzaba le nangifuna kuya le herbal ngiyavele ngiconze straight ngathi ngiye-pharmacy noma kumele ngikhulume nani kucala ngisho ukuthi yatibe ngifise kuyofuna umuntu uma-ulcers herbal noma nje ngivele nje ngiconzele khona.
Vele uconze herbal ngoba asifuni ukuthi uze ufe solo ugijima la ndleleni solo uyakithi ungikhanyela utawuthola khona usizo. So uconza le herbal bayade ukuthi batafike bende njani ukuze khona kusetakala batasitsinza sikhone ukuthi si director ukuthi bakusite kanjani. So ke vele uconze herbal asifuni ushone la ndleleni solo ubheka lena le.
Uyevakala Mr. Mathebula. Uyabuda Brian Themba Sangweni lana ukuthi umuntu obusembali kuphela yini laba khona kuya khona bayothola lamakhathakhatha noma bangaya nakaba besimelane ngale ndazi.
Okay Nkosi. The reason why currently sisebenza kuDubsebhale ukuthi Dubsebhale has been licensed to provide herbal medication to my clients in the country. So asifuni ukuthi sitikhanza sekumikisa lapho khona utazi naseba ngakusiti kahle ungasakhona kubabopha because as a client you have my rights ukuthi if a service provider, a particular service provider akusebenzise noma ke akulaphe wrongly ngibekise when the procedure bakhohlwa scare that is negligence and you can actually press some charges against that particular provider. So it has to be a licensed provider though. So as far as we are provider licensed because then you don't have you not enjoy lama privileges like the provider to task if ever boyofuna imbita elhlanga wakunika imbita ema-ulcers and then complications in terms of your health. So it has to be a licensed entity. So that is why we are using it Dubsebhale because it is a licensed provider in the country to actually diagnose you properly because get the correct medication and if there's been something wrong, you can take them up to task for that.
Sibonga kakhulu Mr. Mathebula, sethembe mhlambe abatowanza impela laba provide makhathakhatha sikhona kuthola kiwo lusido kwathi sekuthi siya understand ukuthi United Health Insurance uhamba ngemithetho lebekiwe mhlambe ngeFSRA nalebekiwe mhlambe betempilo ukuthi ngilendlela lena lekumele operate ngayo balele emakhaya singaba nefele silandzela imithetho nemigomo futhi siyabukelela simaswati ukuthi asifuni ukumixa la utawukhala khona kusasa ukuthi bathi vele lo mfuloni yalaphana ke phana litwana lamsola libuyeli kahle njengoba bathembise ukuthi litawubuyela sibonge kakhulu Mr. Mathebula kusichazisela kabanti ngaleti ndzaba tabo herbal shop ukuthi mama siyakhona lokuya siyokuhlola sithole nje tiwasho lapha ka Dukes Herbal sethembe ukuthi kusasavele sitawukhona kuyanaka babeshume ngale ngendaba sichubeke ke Mr. Mathebula nge-health insurance yakho ngicale ngekubuta kulencane mhlambe kuleni provider ko ingumalini luphi usito lengikhona kulithola ngilikhasmente.
Okay, like bengishito ngos iplan yethu lencane ing-311 emalangeni ngenyanga lokhona ukuthi uyithatha again ima-plans zethu akahle ngalokuthi we have generally the same structure across our plans lokhona ukuthi access. What will then differ is actually the limits depending on your health and your affordability. It will then differ ngalo ukuthi which plan lo ikhanza ukuthi most suits you as a person, but ama-plans ethu icela ku-311 emalangeni uyakhona ukulala esibhedlela if dokotela asufuna ukulala esibhedlela uyakhona ukuthi kunedokotela ubuyele ekhaya na uthola ingoti yemoto nakhona we have a benefit lapho khona sikubhadalela khona lawo ma-bills akho asesibhedlela whereby uthole leyo ngoti yemoto whilst the process of claiming with MVA is being done on the side, but ensure ukuthi your health is attended to first and speedily. And also we have a hospital cashback lakhona nangabe lelo sibhedlela for more than 3 amalanga ketulu siyakhona ukunika for this plan lelencane ngathi amalangeni ngenyanga that we give per day, that would be per day sinika ngathi amalangeni ukhona ukuthi uyisebenzise perhaps also that tikweleti ngoba sesibhedlela you can use it to pay off those debts or any other way lotsa kuyisebenzisa ngayo after be confined in a hospital bed. We are going to have consultations with the doctor. We are going to uthola medication after the consultation with the doctor. Pinza futsi kunemali loyisebenzisa for day case procedures mhlambe bokushintsha amabhandishi those minor procedures singatikhanzi mhlambe sesenza imali yakho ema day-to-day consultations. Siphinza futsi sibe nale OTC lesibita ngesi self medication nangabe ukhanza semhlawumbe uyavuka ekuseni uyeva ukuthi hayi ngathi ngicalwa iflu man uthase ngigijime ngihambe ngelapha epharmacy bakunike that medication ukhona ibele ekhaya so tawulapheka. Kunemali ama appliances la khona kuthenga khona into efana nama crutches nama wheelchairs ukhona ukuthi uthole bo neck support if you need neck support, BP machine if you are someone that needs those kinds of appliances, supplementary care for your outpatient physiotherapy sessions including le Dupsebal medication lebe sikhuluma ngayo. Uyakhona ukuthi bakuthatha scan if dokotela adzinga scan. Uyakhona wenda ama lab tests if you need to do ama lab tests. Phinza futhi sinemali ambulance siyathi usikende kwanza ukuthi sengithi wakhona ukufika esibhedlela so uyakhona kubiti ambulance ikuthatha ikubeka esibhedlela or you need to transfer it from one hospital to the other yena khona lapha iambulance bakhona ikhona ukusita kube nemali maternity lapho khona ukuthi sekubhadale or assist in terms of your giving birth. You have your ANC visits lambisana le maternity 3 visits per pregnancy and then you have maternity scans, which are 2 scans. Nakhona, depending for both the visits and the scans, it depends on the need. If when they will see, the doctor says something more than the 2 scans or something more than the 3 visits, we then use your other benefits as well, like your consultation, as well as your radiology benefits. Depends also on the wellness benefit, like when the annual body checkup, then we have mental health. We give you sessions to go see a psychologist for whatever issues you may be having. People are faced with trauma. Also, the issues of COVID brought a lot of stress. So you can be able to go see a psychologist would see probably to ease you up on whatever is actually then also we give you a benefit if flu shot, especially winter, so that ungatikhanzi mhlambe so ungakhona uba productive because soba njengomkhuhlane. And then lastly we have the funeral cover lapho khona ukuthi if kusakwendeka ukhanza ukuthi there's someone on your plan loseka sishiye emhlabeni, we assist the family ukuthi khona kumfihla. The benefit is up to 10,000 emalangeni for this plan. Sikhona ukuthi si assist my family ukuthi ifihle leyo losashile imfihle ngesizotha.
Sibonga kakhulu Mr. Mathebula, impela undlalile. Cha lona utasayeva ngathi usutaba ke valeni. Ngive ukhuluma ngabo radiology nabo laboratory nabo emergency into ya nalama term la ngasangedulu kwami phathi. Now we cancer awareness month. Lena October nje impela umhlaba wonke uzama ukugcugcutela ukuthi bafu abasebati bati equip noma bafole more information about cancer bahambe bayaticilonga. Emakhasimende ka United Health Insurance asitakala kanjani when it comes to lenzaba ye cancer? Siyakhona yini kuscreena, siyakhona yini kulapheka nasesigula, sitakala kanjani?
Yeah, utsenze inzaba lemcobongozi and le vele siyiteka kulamalanga. It's true. It's actually breast cancer awareness month lesikiyo enyanga October ephani ngeSwati Mbala. In October. So yeah,
October part.
Imbala ngeSwati. So kule nyanga yembala ke sibhizi ngayo i-breast cancer awareness. I do trust ukuthi especially our sisters and mothers have actually taken the time this month to go and do breast cancer screening because it's very important. And actually all other cancers it becomes very important ukuthi usheshe uyihlole basheshe bayibamba so that bayivimbe ingakanzi kakhulu and ukhona ukuthi uchubeke uphile ngaphandle kwenkinga. So our clients actually can nakayowenda le medical, the annual checkup or the checkup, they will have the chance lapho khona batawu check khona even yona le breast cancer, but also they also do lama cervical smears now batawu khona ukuthi check cervical cancer to ensure ukuthi even on that part bangatikhanza ukuthi baba exposed. But also nabo babe nabo singabangeta ukuthi they can also when they do their body checkup they will also get a chance to test for prostate cancer to ensure ukuthi nabo bangatikhanza sebanayo. So yes, we would actually encourage our clients to ensure ukuthi they go for the annual checkup. Actually ngihlale ngisho ngosi ukuthi when you're below 30 you need to do your annual checkup. Once you are above 30 you are highly encouraged to ensure every year you do your annual checkup. And then once you are above 40 it becomes a must to every month, every year, you have to ensure that you've done your annual body checkup to ensure that your body is fine. So we will encourage clients should go for medical checkup. Once you're above 40, it's a must. Ensure that you do your annual checkup every year, so that sikhona kubamba tifo tisaqala sikhona ukugwema even bo-BP sibabambe basaqala basaveta inhloko sikhona kubabamba sibacontrole bangaze babe inkinga konke naboshukela ngoso.
Sibonga kakhulu Mr. Mathebula, sethembe emalangeni ayeva sisembe amaswati lamahle ayeva ukuthi kumcoka lokuthi siyo-check-a nangabe nje leli washe seliye ngale kwa-30 vele kumcoka sisivele sihambe siye emtholampilo. Kona indzaba yila kunabo babe Mr. Mathebula la bemva ngazuthi hayi mina sesengumcemane angikhona ngathi ngeke ngesibhedlela ndawucatheka nangabe uyacatheka ngoba simaswati vele sikhule si-detoxa ngekucatheka athishe nje usindawucatheka ngihlala ekhaya. Kungaba yini mhlawumbe longakhuthatha bobabe ukuthi nanabo inezimashe sikhule sathi ukuthi bo-breast cancer i-breast cancer awareness month but sesifakile ekhathi nabo-prostate cancer ngebuka inombolo letinyukako njalo nje uyobona ukuthi sebakhuluma ukuthi i-prostate cancer, I think it's the second if not the third in terms of numbers when it comes to cancer in the world. Bantu laba infected nge-cancer lamhlabeni. What would you say to encourage mhlawumbe amakhasimende aka-United Health Insurance noma-ke bobabe-ke ekhaya where uthi bumcoka bekohlola nabo cancer noma mhlawumbe simo sempilo?
Yes, Ngosi. That is true. I think July, is it July or June? Lapho khona nakhona besikhuluma indzaba yabobabe Women's Health Month. Nakhona sayikhulumisa le ndzaba ye-prostate cancer. Saphenza futhi sakhulumisa indzaba ye-mental health ikakhulu kati bobabe. So it will always encourage lokho ukuthi bobabe bangazimi abaye etibhedlela. Tibhedlela akusiyo i-abattoir bantu abaya esibhedlela bakhona ukubona dokotela. It is very important ukuthi umbone dokotela ikakhulu kade ngalokuthi futhi Nkosi simaswati asadli nanetingaka nemagusha nemingcushu lokho lento lethu lebetidlwa lemakhaya buthumbu nabumngomeni bantu abasakwati lokho iningi lemaswati nje abasadadle into leyo. So kubese kuyahlupha ke Nkosi ngoba khanza ukuthi lokugula lebe kulashwa lento lethu tinshubaba bese asakhona ukutithola. Mina nje ngiyathi ukuthi na ufike wadla nje ekhaya wadla emahala netishubaba netingaka i-BP vele ijabhe hey nangu lo muntu sangihlasela. So we very much encourage lokho ukuthi Maswati must see the doctor, especially if ukhanza ukuthi isikhathi esiningi sesadla letinto lesididla la edolobheni sesaphila nge-KFC sesaphila nge-Nando's sesaphila ngema-fast foods lokhanza ukuthi they've not been adequately prepared kahle to ensure ukuthi achubeka aba-healthy. So we encourage Maswati to visit the doctor. Ungahlani ne-pain loyivako ukuthi no le pain itakwenga but it's very important ukuthi ungayiva le pain uyayiva ilanga lekucala lesibili lesithathu so nathi i-painkiller but le pain sola ikhwesha. It definitely means you need to see a doctor akhone kuyibona le pain ukuthi isuka kuphi kahle hle ibanga yini and then akhone kulapha the root cause of le pain ungahlali nayo le pain. Lokahle ke Nkosi ukuthi once we have le medical insurance angwete waya lapho khona tibhedlela ukhanza usinemalini lamadze khona. You go to lama private hospitals la ukhanza khona ukuthi emalini akhona mafisha kakhulu. It's just a quick in and out. Uyangena ubona dokotela uyakuxilonga and then you go back home as soon as possible, or you go back to the office and attend to other matters of Zanakden. Akusikahle lokuthi esibhedlela so uthelwe ngesiswati basiluhlaka so ungasakhoni nekwendana so ungasakhoni nekukhuluma ukhanza ukuthi sekuba likhulu nokukulapha ukhanza so sigcina ushiya emhlabeni ngendlela lengakafanele. So we encourage lo ukuthi let's ensure ukuthi siya esibhedlela on time, simbone udokotela. Like sisho once you're above 40, you definitely have to do your medical checkup. Noba kungathiwa kakhulu umnyaka ongengosi, but ensure you go to do your annual checkup so that you are sure ukuthi awuguli nje because vele awuguli, not because kukhona lokubhacile ongakwadi. Doctor aba complicated as uqhubeka ukuphila, and then ukhanza ukuthi akusakhona ukuthi sikucontrol ngoso.
Sibonga kakhulu Baba Mathebula. Sethembe ukuthi emakhasimende impela avile alalele ukuthi akameli simele ukuthi sale sikhwehlela kakhulu noma sale sigula kakhulu ukuze siye emtholampilo. Asizame nje lokusihlola hlole impela isikhathi sesekhona sokhona ubamba gula busaqala. Ngwana sengasekutiyile kutaba inkinga impela ukuthi sikhone kulapheka. Mr. Mathebula, sibuyele kancane nje ngizaba ye-cashback. Le cashback njengoba uke wakhuluma ukuthi lama plans akho ahlukahlukene lele singakhetha kuwo kuhlukene kusike mina elikhikhi lami lingakanani. Le cashback, le hospital cashback le nikhuluma ngayo le ngithola nangabe bengilele esibhedlela. Ngithola kanjani, niyiprocessa kanjani futhi iyalingana yini la kulama plans ethu ukuthi nje lo ka comprehensive nalo ka essential uthola 100 rand wonke noma yehlukana yini?
Yeah, i-cashback Nkosi loyitholako ayifanani, iyehlukana kuye ngale plan lokuyo ukuthi yona i-offerisha malini. For instance, the low plan i-offerisha loyo 100 emalangeni. If you move up, itafike ikunike 200 emalangeni. If you move up, itafike ikunike 250 emalangeni. And if you move up again, itafike ikunike 500 emalangeni per day. So kubang per day, and then kept at 30 days, which means mangabe 100 emalangeni nje shothi igcina ku 3000 emalangeni. Ngabe 200 emalangeni, it means igcina ku 6000 emalangeni. Mangabe 250, it means igcina ku 7500. Mangabe 500, it means igcina 15000 emalangeni. So depending ukuthi ulele esibhedlela amalanga lamangaki from the langa le-3 kuya e2. Asimbali ke Nkosi ngekuthi ngaJanuary ngilele esibhedlela kabili 2 emalanga, and then ngabuya ngaJune ngalalo nye 2 emalanga, bese sithi sesingeda kula January la waJune. Simbala ukuthi Nkosi ulele esibhedlela lamuhla, waphela ilanga lamuhla nelakusasa nemgcibelo solo sesibhedlela. So bese siyaqala ke sesiyakuniketa ke loyo 100 emalangeni nabe 100 emalangeni noma loyo 500 emalangeni nabe 500 emalangeni. Kuye ngokushana ke utawuze ufike kungaphi emalanga solo sesibhedlela, kepha ngeke ngengce kulo 30 days Nkosi.
Sibonga kakhulu Mr. Mathebula. Ngisengafike kunayi question yaphumelele shonge la postile la ka Facebook. Nase nginabe uyaphela lo 3 days ngisesibhedlela. Selanga lesi4. Ngiyaye ngimshayeleni kusho ukuthi uyayitisela ngisesibhedlela nalilanga selesi4. Ngicela lo 500 wami noma kuyaye kwendeke kanjani ukuze ngikhone ukuthola leyo mali.
Okay Nkosi, uma usesibhedlela siyasathi thina ukuthi usesibhedlela, usesibhedlela kuphi, bakugcinile ini. Siye futhi basatise ukuthi esibhedlela solo ukhona nekuthi uchuba kanjani nje, because as a company njengoba kushilo ekuqaleni, we are very much concerned about your health. We want to ensure ukuthi uyanakekeleka esibhedlela ngalendlela okufanele ngayo, and they are giving you yonke le medication oyidingako kulokugula kwakho, and also bangabe sebakunika nalokunye longakudingi, because utawukhanza kusenye ilanga seku affecta even your recovery rate. And also ukhanza ukuthi sebatakuniketa medication lesayitawuphikisana mhlawumbe nalenye medication oyithatha, mhlawumbe une BP, sebakunika i-medication letawukhanza ukuthi seyiphakamisa i-BP yakho. So we need to ensure ukuthi nanathi we also try what we can to ensure ukuthi as you are taken care of esibhedlela, we also keep watch to ensure ukuthi lokulaba kwenda kona nale care plan labakuniketa yona is actually adequate and is actually not in contradiction to some of your other medications that you could be taking, because it's in medical history. So we need to ensure we'll see at all times. So definitely was nakufikelela status sabe sathu sesibhedlela, and nalesi 4 sabe solo sathu sesibhedlela, and we always if need be we will always even at times siye sizame nokuthi site stokuhlola esibhedlela, because ungakhanza ukuthi from what the information abasiniketa yona ukhanza ukuthi it is well enough, but ke singathanza ukufika sive nakuwe ukuthi wena nje ukuthi khanza uphatheke kanjani, because my clients usina ukuthi all the time ahlala aphatheke kahle. So we can even make a visit to ensure ukuthi uphatheke kahle esibhedlela, unakekeleke ngendlela lengiyo and all that. And then we also discuss the issues about cashback, how we are going to actually give you that. But normally see process it in your bank account after so esibhedlela, and then you can use it for whatever means or whatever usage you need to use it for.
Sibonga kakhulu Mr. Mathebula. Sesembe balaleli bayeva emakhaya. Sibuye ne-question yaPhumelele Shonge lo ifake ka Facebook. Uthi Phumelele Shonge, can I join if I am 70 years kule cover?
Siyabonga Phumelele for your question. Unfortunately, currently my plans to join as a member at Kinago 65 years. So you need to ensure before you pass 65, so we set the curve. Once it starts up before 65, as best as keeper once or 10 or 65 and beyond, you can keep your cover for as long as you want to keep it, but you have to join before you're 65. So masona 70 nje asakhona ukuthi sekuthatha sikufake in any of the plans less now, as our cutoff age is at 65.
Ona ngabe nje bengene before lo 65 ngiyakhona lokuchubeka nale plan.
Yes, of course, definitely. Once we join up before 65, we are chubeka nayo uze uyofika ku80, uze uyofika ku90, wherever lapho umdala ukubeka khona dakhona uchubeka nayo, but for as long as you've joined before turning 65.
Okay, sethembe emakhasimende ayeva usikumcoka lo ujoyine le insurance usesengala usesemncanyana nje isimo savuma ungaveli ngoba sewucale bo high nabo ushukela vela nje usathi ngawusuwele i-medical check-up njengoba shito Mr. Mathebula usithi now la bo 30 vele nje ayidinga le medical aid dokhona kwenda le check-up at least inye ngeminyaka ngoba nasewukhula bese sekuya ngekuthi kuyenyukela sekuzinganga singabe abamabidlana amathashwana ngeminyaka. Sisachubeka nje Phumelele uphinze uyabuda lana ukuthi how much can we be covered for a family of 5?
Okay, Ghost. Thank you for that question, and thank you again, Phumelele. All right. Again, because kufuna ukuthi there are a number of factors that we look into before we can actually give you a certain rate. Firstly, the ages labamfu labangena la kule cover. Secondly, lokuthi bahlobene kanjani labantu labangenawo, babe namake nebamfana, mangimake nebantwana bodwa noma ngibabe nebantwana bodwa. So we have to look into those aspects as well, and then also bese ke siyakhona bosi which plan exactly labayifunayo labadala khona ukuthi bayisebenzise. So we need to look at then we can come up with the rate, would say itoba malin. So probably because I think Phumelele can actually contact us. Say discuss the plan the plans that we have, and then we can actually come up with the rate. We'll see Nangalama plans less now, which one specifically do you want, depending on medical needs abo, and then also basis yabo and ages. So so to just shout a figure now to say 1,500, but based on which plan exactly, because we've got different plans, and then we need to also look into the composition of the family. So it will be good. See, plans, the different plans that we have, and then we can come up with the rate from there.
Sibonga kakhulu Mr. Mathebula. Phumelele Sethembe ngiyati ukuthi awukayitholile nombolo oyifuna. Njengoba sayachazile Mr. Mathebula, udaya ngekuthi wena ufuna ukungena kuyiphi iplan nayo ukuthi labafana baneminyaka lemingakhi kevakala ukuthi ubofuna kube nguwe mhlambe nababe nebafana baze babe bathathu. Udaya ngaleyo ukuthi udawungena ngakuphi kune plan lekuthiwa i-comprehensive kune-one essentially kuya nabo prime lama plan lawo lahlukile anetimali letehlukile nanawo ukuthi ufuna wena icover yamalini. Ngibekise nje i-comprehensive i-maximum cover yakhona 1 million emalangeni. Ngethemba ngikhuluma iqiniso Mr. Mathebula.
Yes, Nkosi.
Yeah. 1 million kepha ngilona una 1 million wakakhe noma nje 1 million wethu sonke la ekhaya siyahlephulelana.
So 1 million Nkosi for the family. But what we do Nkosi ukuthi we actually open up the limit lo 1 million depending ukuthi la khaya ngibani otagula lo mnyaka. Mina nje kanza ukuthi vele ngiba ne-flu kuphela lapha nge-winter, angilala esibhedlela kude kunye kwendawo. So mangingahlalela mina lo 1 million la khaya yonke iminyaka khanza ngingasebenzi. So what we do is we open up the limit ukuthi lo yena otakwende kakhulu la khaya kulo mnyaka can actually utilize leyo the benefit depending ukuthi uyisebenzisa kuyofika kuphi. So asikayigali ukuthi lena yalona, but it's open to any member of the family that when they can say will need same across the year.
Sibonga kakhulu Mr. Mathebula. Sibekise ngana ngilomuyelo ohlele ekhaya mhlawumbe uyakubathi uyabuka ngathi mina leya kami imali isheshe iphele ngifisele ukuthi ngiyikhulise. Likhona yini ithuba lokuthi singayikhulisa alikhasimende nahlele ekhaya lingayikhulisa le mali lisuke mhlawumbe la ka primary le comprehensive la kuna 500 per day khona hospital Kersburg.
Yes, definitely Ngosi. Actually kulamalanga nje is sesiya ku December, umnyaka wethu ucala ku January uyogcina ku December. So lokho siya ku December nje nyalo we encourage my clients ukuthi sale aqala afake ama applications zabo for ama upgrades from one level to the other. Lo munye mhlambe wajoyina aselibhungu njengami but ke ngekuhamba kwamalanga ukhanza ukuthi sekucale bo BP sekucale bo shukela. So doubts ukuthi athola iplan lengathi ngihudlwana nalacala ngayo. So we encourage my clients ukuthi alethe lawo applications awo for an upgrade. Sidakhona ukuthi nga December so process lawo applications, and then nga January bakhona ukucala on those new plans le batabe bathi bacela upgrade akuyakiwe. But again Nkosi ngisho ukuthi upgrade is not automatic. Is subject to review and the approval from the office. So you apply for the upgrade and then sikhona ukuthi kuphendule before uphele lo mnyaka before uphele December we give you the response, and then nakucala umnyaka lomusha you have upgraded, and then so yakhona ukuthi uqale le plan lensha le takhona ukusustain across the year in the new year.
Sibonga kakhulu Mr. Mathebula, sethembe emakhasimende ayeva naphumelele naye mhlawumbe nangabe unembuto mhlawumbe kwelekela noma ufuna kuva kabandi ukuthi mina nangikhetha lena iplani ngingena kuphi ngibhadala malini, ungasishayela aphumelele between 8 o'clock na 5 o'clock Monday to Friday. Nombolo yefu yamahhala lethi 800-1010 800-1010 lapho sitawukhona ukuchazela kabanzi yamahhala le nombolo akudingi ufake nje ufake nema-minutes uyashaya cellphone yakho uyashaya ngecingo lasemsebenzini ukhona ukubuta konke lofuna ukubuta ngalo mshwalensi mhlambe lokhona. Sicela kubuta mhlambe sesivala Mr. Mathebula ukuthi leli khadi la United Health Insurance liyasebenza yini ngephandle kwelive la kaNgwane noma nje sisebenzisa la kaNgwane kuphela?
Okay, no, thank you, Ngozi. Maybe just before I attend to that one, umuntu akasho ukuthi we also have a team lengakhona ukuthi ikhona kuyomhlola client wherever lapha khona ikhona kumchazela about the plans and akhona ukuthi bamsign up. So actually even companies siyasa encourage ukuthi they should invite us, sit there to their offices, sikhone to speak to their staff, sibachazela about the different plans that we have, and then sikhone kubendela ne package labangayithatha, and then bakhone ku coverage their staff with us. And then coming to the question yakho, yes, definitely my clients anayo access to South African hospitals primarily, but also we do have access to even other countries like Botswana and Mozambique. We know that there's a lot of travel between those countries. So my clients makwende ukhanza ukuthi la eSwatini sekune specialty tsite le singa lesiteso la kaNgwane siyakhona ukuthi assist the client and visit that facility in South Africa or elsewhere. But also kende ukhanza ukuthi Nkosi ke bewuvakashile noma bombe ngemsebenzi that country sekuvela lenkinga ke leseyikuvekela ungasakhona kuba for instance uma unenkinga enhlitiyo ngeke usuke nenhlitiyo mhlawumbe eJozi ofika naKaNgwane can attend, so it becomes an emergency. You need to see a doctor then there nakhona lapho siyakhona ukuthi assistant, but what becomes important lo ukuthi immediately that happens or immediately usokhona kusinza after so sitakele ukhona ukuthi uchumane nathi so that we can then make the necessary arrangements naleso sibhedlela leso ukuthi sikhona ukuthi sibabhadale ungazokhanze so ukhipha imali yakho yokudla so ubhadala leso sibhedlela for leyo bill yaleyo attention esibakunike yona. So kuba ngiloko, but otherwise they do have that access to actually be assisted outside the country. But also nje sokungaba kukhanza ukuthi lesikhazi maybe uhamba ngemsebenzi even beyond South Africa, it becomes important ukuthi perhaps you can let us know and then we can always make arrangements to ensure ukuthi wherever la uyakhona you would be assisted in the event you need medical attention wherever you are. So that is all possible with us. We can always facilitate for that.
Sibonga kakhulu Mr. Mathebula, sengumbuto we second of the last sesiyaqedza mphathi. Ngikuna nangbabe mhlambe noma make noma somabhizinisi ekhaya lonetisebenzi mhlambe letilithandanyana ufuna kwathi ukuthi ngingakhona yini ukubhalisa tisebenzi tami noma nithatha nje lamba labatihambelako nangabe ngiyafisa kwenda lokho ngenda kanjani ukuze ngikhona ukuthi babe covered?
Yes, Ngozi. Yes, loyo somabhizinisi angakhona kubathathela tisebenzi takhe leyo medical cover. Lesitakwenda ukuthi siyakhona kufika kuye sikhulumisane ukuthi tisebenzi takhe tingakhi simakhele leyo group package at 70 takhe bese ke sesiya khona ukuthi end lawo ma payments for leyo total at 70 ukuthi mhlawumbe takha malini. Kuyashiyana ke Nkosi, labanye bathi mina ngidawunakekela 70 sami kuphela, labanye bathi ngidawunakekela 70 sami nefamily yakhe. So kuyashiyana ukuthi leyo naloyo mcashe mhlawumbe ufuna kwenda kanjani, but ke yes, once bavumelana ukuthi batawu kwenda kanjani, we are able to make leyo group bende leyo bulk payment for let's 70 tabo, but also labanye baye bathi hey ngidawukhohlwa mina loku processa le mali noma ngayisend invoice, but please do a debit order. We're also able to do that. Sikhona ukuthi we run a debit order yaleyo mali let's 70 ikhona ukuthi ama premiums abe serviced, ama policies abo abe up to date. So konke lokho siya khona ku facilitate, we do make lawo ma discussions with the employer, send ama covers for them.
Sibonga kakhulu Mr. Mathebula. Kunelkhasimende lelike labuta ukuthi ngibona njani sengisele namalini medical aid yami ngoba ngasuke ngisiya esibhedlela bafike bathi hawu seyiphelile imali la Nkosi. Ngibona njani ukuthi nginamali sengisele namalini?
Yeah, thank you Nkosi. That is true, especially nje lokho sekuphela umnyaka. Kuba kunengi ukuthi ukhanza ukuthi bantu baya esibhedlela ukhanza ukuthi ama benefits abo say exhausted. Specifically labo consultation and outpatient medication ukhanza ukuthi ngeke kakhulu ukhanza ukuthi sekabe exhausted. So abantu kufuna ukuthi firstly they should ensure ukuthi ama emails abo ayasebenta and basiniketile and bayawa check. That would be one, because we always send out a notification to a client every time we receive a claim from any provider. So we send out that notification to the client could say at today claim yamalini leqhamuka kuphi and sasi process it. And then also a client can actually log in. We have a client portal, self-service portal. Lapho khona bakhona ukuthi ba log in using le email address yabo labasinikete yona or a cell phone number yabo labasinikete yona. So you need to ensure ukuthi all of the details nglawa labasinikete yona application form yakho, then you'll be able to log in. So if you need the email, you can use your email. If you need a cell phone number, you can use a cell phone number. Ungabe sofaka yaso mobile kana wasinika MTN, noma ungafaka MTN kana wasinika yaso mobile. So it has to be the number wasinika down ku application form yakho. And then also yofuna ukuthi uqale ngalo 00268, then you put your number. Itabe siyakhona ukuloga. You register. Once you've registered, itokhona ukufaka into your own profile, your policy. Takomba everything, your premiums that you are paying, the number of people that you have on your plan, your benefits now, authorizations now, now bekondegile when the procedures or wahamba wenda or lespedle. It will show you all that, all those details, all that history, including good source in any of the benefits that you have. You are able to check from the service provider portal. But also, lastly, you can actually call us on our toll-free line or on our UHI numbers. But we would very much encourage those clients to use the self-service portal all the time, and also using their emails to check the notifications that we send on processed claims.
Sibonga kakhulu Mr. Mathebula, sesebe makhasimende ayive ekhaya ukuthi uyakhona nje kuhlola ukuthi sengisebenzise malini, ngiselena malini emalini yami ekuvakashela emtholampilo. Balalele emakhaya kuyimpholo enhle lena, hayi lokuthi uye esibhedlela ubungadine ukuthi ngisebenzise malini, kepha ngisebenzise 20 rand sekusele imali 20 malangeni sekusele malini. Sibonga kakhulu United Health Insurance ukusilethela impholo enhle kaso ukuthi nje nawe unayo lo mshwalense wakho wetempilo yakhona kuba ukuthi esibhedlela thiteni ngisebenzise imali lengimalini sengisele namalini yini lokunye mhlambe lokusele lengakhona ukukusebenzisa ngelikhasimende. Sibonga kakhulu Mr. Mathebula. Sezivala Mr. Mathebula kwegcina ngci. Last question Mr. Mathebula. Ngilisumfundisi nakathi as I close. Mr. Mathebula, ngine-pharmacy yami noma nesibhedlela sami. Niyakhona yini ukungemukela ukuthi nami ngibe service provider nangabe nikhona kuyini lekumele ngiyende ukuze ngikhone nami ukuthi emakhasimende ka-United Health Insurance avakashele ngakimi athole kwelapheka?
Oh yes, ngiyabonga Nkosi for that question as well. Maybe just to probably add kuleya question yakuqala, iportal ma clients bangayithola ku website yethu. I think iyabonakala lapha eceleni kwaSimphiwe, www.united.co.za.
Ayikhona la eceleni kwakho Mr. Mathebula.
Yes, so clients can go there, bangene ku UHI tab, United Health Insurance tab, and scroll down, but ayithola i portal from there. Bakhone ku register. So if a client, you will use the client service, the client portal or member portal, and then if you are a service provider, you use the service provider portal in our Bakhone Goods Bank Assist. Coming to your question, yes, we do encourage providers to actually partner with us. Again, just like sikhulumile ngale ngemthetho masikhuluma nge-Dosebal, nangala kulawa laka esilungu ema-providers nakhona we want ukuthi babe compliant with medical and dental council. Kufuna ukuthi babe abantu laba registered and fully accredited to service clients. Bese ke sesifuna ke nalama documents labanye ke ukuthi inkampani phela yakhiwe ngokomthetho, singakhanzi ukuthi inkampani ayikho ngokomthetho, certificate of corporation and all that, trading licenses, we'll need that also. Then also we'll have to come and check lama premises akho. Singasho ukuthi une pharmacy somewhere lesingathi nekuyade ngoba elinye ilanga inceda silethela tipoko tema claims lesingeke sikhone wa attached anywhere. So we need to come and see your facility, if it's a pharmacy, but also if it's a clinic. Again, if let's check out the clinic ikhona kwenda inani, because asifuna ukusipesa ukhanza ukuthi software nangiyakhona kwenda a certain procedure kanti ude nale facility ekuyena. So we need to check ukuthi iya comply in the facility le clinic yakho yini lekhona kwenda ilingakhona ema limits ayo. Then we sikhona we accredit sifaka system, and then we sign a service level agreement lapho khona staff khona vumelana ukuthi ema clients ethu utawa assista kanjani, standard law assistant ngaso nasi, siphinde sikhulume ukuthi even ama payments stawa process kanjani for lawo ma claims lo so uwendile, because again asifuna ukuthi ukhanza ukuthi if say the agreement utasona so charge iPanado you charge 20 rand kanzi 10 rand, so bese kuba inkinga lo because ucedza lama benefits ay client ngalonge emthethweni. So we need to agree on all those things, and then ke sesiyakhona ukusign up, you can then service our clients. So nakhona lapho you can just contact us in the office, you can call our call center, or you can use our emails ukhona ukuthi usinze, and then we'll start the process here, we'll sign up and accredit you to service our clients.
Sibonga kakhulu Mr. Mathebula. Yami imibuto iphelile mphathi njengoba ngishido. Kuna senani kwala ukuthi umbuto wegcina uthi indzaba ye-cashback iyasebenza yini ngabe bengireferishwe to South Africa sengisuke ngihlala sikhashana nje lesimbalwa le South Africa, iyasebenza yini indzaba ye-cashback khona?
Interesting. Yes, Ngozi. Le cashback ikhuluma ukuthi you have been confined esibhedlela for more than 3 days. So mangabe boye eSouth Africa nakhona lapho itawukhona kusebenza le hospital cashback itawukhona kuyiclaim. So ngeke kube nenkinga ngosi ukuthi bowula kangwana kwenza sikhwahlande, but as long as bo-confined esibhedlela sitawukhona ukuthi sikubhadale ngosi.
Sibonga kakhulu Mr. Mathebula, sibonga kakhulu bonke abalaleli bethu lebe babuda imibudo nalebe ba-commenta nje impela la ngephasi ka-Facebook. Sicele nje ukuthi kulaleli vile litako usijoyine bonke bolesine siyavela lana ka-Facebook sizame ukukhuluma ngayo ngetindzaba temshwalense letehlukahlukene. Ungamema namakhelwane, umeme namzala nababe ekhaya, nitendawo lalela nibukele, nibude futhi nemibuto leningaba nayo ngema-products aka-United Holdings. Kungaba United General Insurance, kungaba United Life Assurance, kungaba United Health Insurance noma United Pay. Siyazama ukuthi sikulethele konke lekumele ngabe uyakwadi. Sesivala Mr. Mathebula, kukhona mhlambe lo ngafisa mhlambe ukucududela kuwo makhasimende.
Siyabonga Nkosi, maybe nje kungaba ngokuwacududela amakhasimende ukuthi akete atofaka ticelo tawo tema-upgrades sitokhona ukuthi siti-process so that sicala umnyaka lomusha nje sewucale ukhanza ukuthi sebane-plan letawukhona ukuthi ikhone kuba sustainer for the year, especially nangabe ukhanza ukuthi kwentekile across the year wakhanza sowucetha ama-benefits akho. So we just want to encourage clients to come and upgrade their covers which will be processed in December. Other than that, Nkosi kungaba kubonga for the interactions kulabo laba sibutile imibuto and the contributions, and also ukuthi bangasinza at any time. We will be available to attend to them and give out the necessary information that batayidzinga as they take up covers with us or keep their covers with us. Kungaba ke kubavalelisa and also sibafisele impela sondlo lenhle legcwele tibusiso baphephe ku-COVID njengoba isekhona nje bachubeke bagweme lento ukuthelelana kwayo i-COVID. Kulabo labakhona kuyawujova siyabakhuthaza nabo ukuthi bajove sitokhona ukuthi sibuyele ku-normal life singadikhanzi solo singakhoni kuya kahle emasontweni singakhoni kuya kahle kuma birthday parties, kuma baby shower tonke lento leto. So asikhona nje ukuthi sijove sitokhona kubuyela siphile normal life sikhone kubuyela empilweni yethu. So bakhuthaza ukuthi bajove baphephe ku-COVID and also nekuthi-ke baqinisekise ukuthi ama-premiums abo babhadala on time, bangatoba nema-challenges uma ngabe sekwendeka baya esibhedlela. Siyabonga Nkosi, impela sonke beyinhle.
Sibonga kakhulu Mr. Mathebula, sethembe amakhasimende ethu sekavile ukuthi asichubekeni sitiphathe kahle. Sakhona kuwende ba-baby shower njengoba sekashito Mr. Mathebula, ushito uzufuna kubitwa ukuthi ngibabe Mathebula. Ngide yabo ufuna graduate nje siyomendela yena baby shower. Makhasimende lamahle nangabe nifisile kuvaka abantu ngale besikhuluma ngabo noma lokunye lesingakakhulumi ngabo, ningashayela inombolweni yethu yamahala lethi 800 1010 800 nibudele ningafisa ukubuda inombolo yamahala lena utawukhuluma nje impela kuze kuphele konke lebo fuza ukukhuluma. Kanti nangabe nje umuntu lohlala la esandleni ecingweni ukhona WhatsApp wethu ungasendela WhatsApp ku-7808 8050 87808 lapho utawusitakala uveka bandi nangabe ufuna kuvaka bandi nangabe bofuna ukubuda nangemshwalense wakho useseume kahle yini uyakhona nokubuda ukuzelele Mr. Mathebula kusasizameni ukuqhuba inyanga embili noma sibhadale imshwalense wethu ngesikhathi sitokhona kusitakala singadikhanzi nje sesikhala ukuthi hawu mina bengisolo ngifaka imali solo wangisasitakali ngenxa yokuthi nje upholete lelo langa linye. Sithembe sinalendlela elitako khona kupita makhelwane namzala nababe kusebatobukela kanzina ngabe uhle ukhohlwa uma uflokohla konje lofana nami ungathi nje ufaqade kancane lapha kule screen sakho la icingweni uchafade nayibheli basi insimbi nayibheli lebakhona nje lapho ufaqada yona uyakhona ukuthi ukhethe ukuthi every time United Holdings nakaliba live uyakhona nawe ukuthi watiseke utawukhona kubukela impela sofa ibe yinhle emalangeni lamahle sithembe ukuthi indawo ichubeka nje iphathe kahle impela start cancer inew normal seyibekwe eceleni sesibuyela le ndlela lebesiphila ngayo na itolo inkosi yemusa inibusise nibe nemphela sonto lenhle legcwele